Hello and welcome to our event tonight as well. Online patient meeting is again here with us, and we are happy to be back here. This time we are here with Laura. Hi, Laura. How are you feeling tonight? Hope you can hear me.
Hi, Christina. I'm feeling good. Caroline, sorry.
It's all
How are
right.
you?
It's good to have you here. And yes, I am Caroline. I am your host. So let us know that you can hear us. So we want to make sure that all is working. Thank you. I can see someone is typing. So thanks a lot for that. And well, tonight we have another interesting topic to handle. So of course we will talk in a minute about that. But before this, please let me remind you about why we are gathering here every single day, as you know, twice a day even. And well, we are here just because we want to support you throughout our uncertainty right now, as nobody is able to proceed with the treatments. We are mostly stuck at home, so we just want to give you an option to ask your questions to top fertility experts, but also some interesting topics we are having for sure. So I'm sure it will be also useful to many of you. And all of this has been able to happen since we have our ambassadors and partners. Without them, it wouldn't be possible. So again, I would like to thank them for their support and helping us out and bringing the Stronger Together initiative. You can see them right here as well. And tonight we definitely have a very interesting topic. And Laura Bicker, she will be talking about how acupuncture works, and she will be able to explain how Chinese medication can help when it comes to IVF treatment. So she will be helping you with understanding about this definite topic. And remember, you will be able to ask your question. All you need to do is just type in on those questions in the chat section, and Laura will be answering them for you after the most common questions, where she will explain all the details as well. And well, Laura, I guess you can tell us a few words about you and make a short introduction before we go to the questions. So go ahead and do it.
Thanks, Caroline. Thank you for having me. Hello, ladies. So I'm a traditional Chinese medicine practitioner, and I have been practicing since 2005. I have my own private practice, and after about a year of working, I started seeing a lot of patients for fertility help, and very quickly found that I was having very good results, and so that led me to specialize. So from 2006, I've been working helping patients on their fertility journey. So I really just wanted to discuss with you Chinese medicine, how it can help you, explain a little bit more about it, so to help you understand how it works, and what to look for when you're trying to find an acupuncturist. And then obviously just how we can help during COVID. So I guess as a place to start, acupuncture is talked about quite a lot in relation to fertility, but a lot of people don't really understand what an acupuncturist is. So when I'm talking about an acupuncturist, I am referring to somebody who has studied at least 3 years at degree level and uses the full diagnostic Chinese system. So is a traditional Chinese medicine practitioner with the acupuncture. So when you're looking for somebody, I would say you want to find someone who has got a degree level qualification. You might want then to look beyond that and look for somebody who is specialized. These days, quite a lot of people have decided within the acupuncture community that they're going to specialize in one particular subject. So there are people out there who do work in the area of fertility only. And that usually encompasses women's health, things like PCOS, endometriosis, but also male infertility, because obviously it takes two, and we have to look after both sides and take them both into consideration. So I personally am part of something called the Fertility Support Network, and we have a practitioner group, and we have all completed the fertility support diploma. Now, that is like another level of training. All the practitioners within that group have at least 5 years experience, and as part of the training you learn how to work in an integrated way with Western medicine. So you learn the Western medical diagnostic techniques that are used and use them together with the Chinese medicine and the acupuncture. So when we were training, we spent time with an embryologist, we spent time with a reproductive immunology specialist and IVF consultant. So we have a lot of knowledge and experience around IVF and around the artificial reproductive techniques and how to integrate those into our practice as well. So if you've got a really complex case, or your history is quite long and protracted, and you maybe feel like you need somebody who's got that deeper level of knowledge, or maybe can give you a little bit extra, then I would say that kind of group, like the fertility support practitioners, or whatever the equivalent is of where you live, if you're from a different country, then they might be what you need to seek out.
Perfect. Thank you so much for explaining this to us. What is acupuncture is actually, because as you said, I think it's not so, I mean, not lots of people actually are aware of that. So thank you for saying that. Thank you for your introduction. And we will now go to most common questions. Yes. And of course, then it will be time for your questions. I'm sure you have plenty of questions. So go ahead and type them in the chat section. But let's start with this one. How does acupuncture work?
So if we look at acupuncture on a very simple level, and we talk about what acupuncture is initially, acupuncture is the insertion of very fine needles into specific points on the body, which are located along energy pathways called meridians. And a lot of patients will ask me, how does acupuncture work? The first thing I usually say is, if you think of it on a really basic level, that the needle has been inserted into your body and your body will react to that in the same way it would if you injured yourself. Your body will increase circulation to that area to try and send everything that your body needs to heal. And so it has a stimulating effect on the body. We are starting to see lots of more research come out around acupuncture, and the scientific world are starting to give us the real answers as to how acupuncture works. So one of the things we now know is that acupuncture stimulates the release of beta endorphins. So beta endorphins are responsible for reducing stress in the body and achieving that kind of homeostasis, that balanced situation. And they also are found within the hypothalamus, they're found within the pituitary gland. And these are all really important organs within hormone production. And so in terms of fertility, if we know that acupuncture helps produce endorphins, helps relax you, and it works on the hypothalamus and the pituitary gland, we know that it's going to have a benefit. You've got two axes that are talked about within medicine around fertility. So you've got the HPA axis, which is the hypothalamus, the pituitary, and the adrenal gland, and the HPO axis, which is the hypothalamus, the pituitary, and the ovaries, and how they all work together in their little biofeedback and interact and keep our hormones in balance. So for example, if you're really stressed and your cortisol levels rise, your adrenals are going to work harder, and that's going to have an impact on how the hypothalamus and the pituitary gland function and how your other hormones are produced. So acupuncture really just helps balance these out, helps keep these axes working, in a nice, clear way. Another function that we know acupuncture has from research again is it's been shown to improve what's called the pulsatile index. And so what that is a measurement of resistance of blood flow. And it's shown that it improves that. So if acupuncture improves blood circulation, Again, in terms of fertility, we know that it can help increase circulation to the ovaries, to the uterus. And this again, has many benefits. If your blood circulation is better, it's going to increase nutrition to your ovaries. It's going to get what your body needs where it needs it. It's also going to mean that your ovaries are potentially going to function better. So if you're in an IVF cycle, it's going to help increase the response potentially. It can also then mean blood circulation is increased at the uterine lining, so it can thicken better potentially. Or when you're having a period and the lining is coming away, it's going to come away more effectively, and hopefully you're not going to have kind of clots or bits left behind. So when you have your next cycle, you're not going to have so much old blood, those kinds of things. Circulation is just really key in Chinese medicine, and it's one of the very basis of everything we do. Is if we know the circulation is good, then we know the body is going to function better. Another thing that acupuncture has shown, or has been shown in research to do, is also modulate what's called the cytokine levels and the cytokine response in the body. And cytokines are just proteins that the body releases in lots of different processes, but two that we look at quite a lot in terms of fertility are cytokine response in inflammation and in immune response. So again, if you're thinking about kind of conditions like endometriosis, we know cytokines play a role in that. And also male infertility, we see high levels of cytokines in semen when there are fertility issues. So acupuncture can help modulate the cytokines and improve these situations.
Perfect. Thank you so much for providing all the details on how it works. Definitely interesting. And well, let me go to the next question. So, what are Chinese herbs? Are they safe, and do I need to use them?
Okay, so I wanted to talk about Chinese herbs because I really feel like they are the unsung hero of Chinese medicine. They get forgotten, and a lot of people don't realize that actually a lot of the work we do in terms of treating fertility and supporting patients in preparing them for artificial reproductive treatments involves Chinese herbs. And there's still a lot of fear around herbs, maybe from articles people have read that herbs may be toxic, that they may affect the liver function, they may affect the kidney function. So Chinese herbs come in lots of different forms, and in my practice, I prefer to use what we call a granulated form. It's very much like instant coffee, so it's very easy to use. But different practitioners will use different types of. They might use dried herbs. They might kind of make herbs up into capsules, that kind of thing. So, first of all, they come in lots of different forms. They've been used for over 5,000 years, and they really do have a very good history of safety. And the side effects are pretty minimal, particularly if you compare them to pharmaceutical drugs and the side effects that they have. Chinese herbs are actually very, very good. Within the UK, we have a couple of governing bodies as well. So we've got the Register of Chinese Herbal Medicine and the Association of Traditional Chinese Medicine. So when you're looking for a herbalist or an acupuncturist who uses herbs as well, it's important to make sure that they're registered with somebody like that. And then you know that the herbs they're using will not contain any banned herbs. So any of the herbs that you may have read about with toxic properties, we're actually not allowed to use anyway in the UK. So that just doesn't happen. We don't use any animal products in the UK. So, if you have concerns about that, that's not an issue. They're mostly plants that are indigenous to China, but actually we use a lot of herbs that are really, really common. Things like mint, ginger, licorice, dates, they're not all as weird as people may think. So Chinese herbs are really great for putting back what the body hasn't got. And if you've got long-term chronic conditions, again, going back to things like endometriosis, PCOS, or it could be that you have other health conditions aside from, fertility issues that are actually having an impact on your health. We now know how important gut health is in so many aspects. And so if you've got digestive issues, herbs can be really great for getting your, digestive health back on form. So I really, want people to realize that herbs are really not as scary as they might think, and they're not as unusual or weird as they might think. They might taste disgusting, that's for sure. Not all of them, but there really is a big role for herbs in fertility treatment for sure. The other thing as well is that I often see patients are really concerned about herbs and their use around an IVF cycle or any fertility treatment they may be having. If you're seeing a really experienced practitioner, they really generally will not use herbs around an IVF cycle. Or say, for example, if you've just started Clomid, if it was my patient, what I would generally say is, okay, let's watch and see how you behave with the Clomid, how you get on with it first. We're not going to add herbs into that equation until we know what's going on. And at a later date, herbs might be something that we would consider if the body isn't responding in the way that we want it to do. So a herbalist will always stop herbs before they start an IVF cycle of medication. We know what the half-lives of the herbs are, so we know how long we should be looking at in terms of those things. So it's really not a big concern around fertility treatment. But also, you've got to spend time and just speak to your practitioner, and they'll explain things to you if you are unsure. But I think one of the things to remember is as well is that we all have the same goal. We all just want our patients to, have that child that they really long for. So we're all just trying to do our best.
All right, perfect. Thank you so much. So we definitely shouldn't be scared about Chinese herbs. We definitely should consider them safe. All right. So thank you so much for this, for reassuring. Yes, because it's true. I heard many times that it might not be actually that safe. So thank you. All right. So let's get to the next question. So who should have treatment?
So, I mean, everybody can benefit from acupuncture, that's for sure. If we're talking about endorphins and how it can regulate that stress response and relax you, I'm pretty sure most people will benefit from a good chill out session. But when we're looking at it in terms of fertility, it's really thinking about, well, who's going to show up at the clinic? The majority of patients we see are definitely female, and often we'll see a female come for a consultation and then they'll tell us, oh, but the problem is with my partner, he's got sperm issues. So, don't forget that we can help the man and for men to come along and get treatment as well. But also, acupuncture and Chinese herbs can help you at all stages and in all manner of, situations, all different types of artificial reproductive techniques. We tailor the treatment to what you need and where you're at in your cycle or in your fertility journey in general. And I think you've just got to kind of plan ahead and think, where am I? What do I need to do? And that's where we are. We're there to help you and help plan your treatment and prepare you for anything you might be looking to undergo as well.
Excellent. Thank you so much again for letting us know that anyone actually could do it, could use it. All right. Thank you. So when should I start acupuncture herbs for artificial reproductive techniques?
So ideally, you should really find somebody to help you at least 3 months before you start any art treatment. The reason we would like to see patients 3 to 6 months before they start treatment is because we want to help make a plan for you. And one of the things we find quite a lot is people will get in touch, sadly, often late. Our diaries do fill up very quickly. So being able to accommodate people for the appointments they need is sometimes difficult if they get in touch too late. But also we look at things like the life cycle of, a follicle. So a dormant follicle in the ovary through the time to when it is recruited to become an active follicle is around, I think, is it 130 days? It's roughly about 3 months, 4 months. And it's the same with sperm, it's about 90 days. So for us to kind of have an influence on what is being used or what is going to kind of respond to medication, we need that little time scale so things can start working in the body. Also, it gives you time to implement any lifestyle techniques that we might discuss, start supplements, that kind of thing, make those changes, and for them to start having an effect on you and your life and your body. There's no good kind of, starting some supplements 3 days before you start your IVF cycle because they're not going to have that impact. But also, we see patients quite a lot who we will come and we can help them conceive naturally. So if there is the potential that we can help you do that, it's nice if we've got that time. And if that doesn't happen, at least we've got your body in a much better position for an IVF cycle. So an example, is, say, for example, somebody had PCOS. I'll never forget the day one of my patients walked into clinic and she had this really sheepish look on her face. And I said, "What's up?" And she just said, "I've had a period." And she'd had her first period at 26. And, we were able to do that through diet and lifestyle and acupuncture and herbs. So, we can have a big impact on patients. And if we can help you get where you need to be, we'd much rather see you do those things if we can. But at least, that patient, if she went on to do IVF, is going to respond a lot better because her cycle is going to be more regular. It's going to be closer to the norm. So those are the kinds of things we'll try and achieve with patients if we've got plenty of time with them before they're starting any reproductive treatment. The other thing as well is we'll take into consideration patients' journeys. So it may be that, a patient comes along and they've already done 6 rounds of Clomid, they've already done IUI, they might have done several rounds of IVF. And these things all take a huge toll on the body. So part of what we like to do if we've got enough time before somebody kind of gets back into treatment is to really build their body back up, nourish their body, because, particularly if you've done several rounds of IVF, you'll recognize that it's very exhausting. It has an emotional impact on the body. And sometimes there are things that are left behind from the medication. So people may still be experiencing things like night sweats. They might feel their hormones are fluctuating and they can feel that in their mood and other kind of hormonal symptoms that are coming to the surface. And these are the things that we try and improve before a patient starts treatment again.
Perfect. Thank you so much again for all the details you have provided on that. Very interesting indeed. And we will be slowly starting with your questions. So if you have any, go ahead and type them all in. But now let's get to the next question. So how often will I need treatment during my art cycle?
So this will vary depending on the treatment protocol that you're receiving. Whether it be a long protocol cycle, a frozen cycle, a donor cycle. But for a rough guide, if I give you an example based on a long protocol cycle, most of the time patients will be seen around once a week through the downregulation stage, or if you're on the contraceptive pill, we would still continue to see you about once a week. Then during the stimulation phase, we'll continue that once a week pattern, but we'll also then edit it based on your past history. So if you're a poor responder, if you've got low ovarian reserve, then we might increase the frequency of treatment to match that. Also, as you have scans and that gives us a bit more diagnostic information, we may increase treatment. So if your first scan, we're not quite seeing the follicles at the size they need to be, or you haven't got quite as many as we would have expected, then we will up the treatment to try and increase the circulation, increase the response. Every practitioner does also have their own kind of style and protocol, and everything is always tailored to you as the individual. But in general, there may be a treatment around egg collection. So for me personally, logistically, it's often difficult to do a treatment after egg collection, I've found. And one of the things I'm always thinking about is how can I reduce the stress levels of my patients? So one key thing to think about is, if a treatment is going to increase your stress, is it really worth going for it? So we will put them in where we think it'll work, but it's not always the end of the world if you miss a treatment, if that treatment was going to cause a lot of stress to you. So I found the post-egg collection treatment is not one that I use as much as others. But again, if I see a patient who's had a history of a difficult egg collection, or maybe has cervical stenosis or something like that, that we know is going to create a difficulty, then I will focus more around egg collection. Then the next key point for treatment will be transfer. So again, it'll depend on, if you're having a frozen cycle, we know for sure what day transfer is. But sometimes it's not so known and it's a little bit last minute. So you might not have the ability to have a treatment before and after transfer. But again, that's not a major worry. But most of the time, we would expect you to come after your transfer, usually on the same day, at least within the 24 hours. Then we'll look at the 2-week wait situation. So we can do treatment around the point when implantation would usually occur. And we can also do treatment throughout the 2-week wait, just to really support you at that time, because we definitely see that that's probably the hardest point for most patients, because you've been so busy going in for scans and here, there and everywhere for appointments, and then it's just so quiet and you're left alone with your thoughts and you're waiting for that test day. So acupuncturists will offer a lot of support emotionally in that sense, and we can relax you and get you through those 2-week wait. Then if you do have a positive, we're there to support you through early pregnancy. We know that there are increased chances of miscarriage with IVF in the early stages, and actually there's quite a lot we can do to support early pregnancy. Even just from an emotional point, research has shown that women with a recurrent miscarriage history treatment, by having someone to see on a regular basis to discuss their anxieties, it actually reduced the miscarriage rate quite significantly. But also there are things that we can do with acupuncture, and again, herbs. I use herbs quite a lot in pregnancy to support my miscarriage patients. So again, that's something that a lot of people wouldn't think about, would probably be quite anxious about. But what I find is that my patients, they know me so well by the time that they are pregnant, they have a deep level of trust already. And so, they're very comfortable with what we do. But there are things that we can do to help support early pregnancy as well. But really, it doesn't matter what kind of artificial treatment you're having, we can tailor it to that treatment. But once a week, roughly, so in a long protocol cycle, you're probably looking at around 6 treatments. And again, don't forget the men. If there's male infertility issues, we can do the preparation work, and we can do some treatments on the run up to when they have to give their cycle as well, cycle their sample, and also relaxing them, ready to produce their sample can be helpful. It's a very anxious time for a lot of men, and they really find, giving their sample quite difficult. And often, actually, the setup in the clinic isn't that great. it doesn't really help relax the men. So doing what we can to help relax them ready for that is also really helpful.
Excellent. Thank you so much again for explaining and providing all such details. Definitely interesting, and more and more sounds more and more for sure useful. Okay, let's get to the next question that we have. In current situation, so what can I do now in lockdown?
So, we're quite stuck, and a lot of patients have had cycles cancelled, and it's a really difficult situation, especially, I can think of some of my patients who have been waiting such a long time to find the perfect donor. They've been so excited to finally get going on their donor cycle, and now they're kind of like, yeah, 2020, that's written off. I'm not going to be a parent this year. So acupuncturists on a whole are opening up our practices to online consultations similar to this. And so what we can do to help is we can still run through the same things that we would in a normal initial consultation. And we can go through your health history. We can look at your lifestyle, look at what supplements you're taking. If you're looking for somebody who is an advanced fertility support practitioner like myself, and we've got that integrated training as well, we can also spend time reviewing past blood test results, looking at, is there anything that's been missed, are there any other tests we could look at, just making a really detailed plan of what would your next step be. If you're at the stage where maybe you had a consultation arranged, it might have been, your first consultation at an IVF clinic, or you're going for a follow-up, you might want to make a plan of what you're going to say, what you're going to ask. And so we can also come up with those questions and help you build a plan and review maybe what your past cycles have been like. How many follicles did you produce? At what point were you losing those follicles? Did you have any symptoms of implantation? Those kind of things. We'll go through it all with a fine-tooth comb and really focus on what we should be looking at moving forward and what we can do to help you. And then we can give you, that lifestyle advice again, any supplement advice, those kinds of things. I think as a whole, fertility acupuncturists are a good source of information. We're very passionate about what we do. Our continued professional development always focuses around this subject. So we're constantly learning and developing new knowledge around this area, trying to stay up to date so we can give our patients, the best information available. And so, we can share that kind of information with you and make sure you're doing the best for you. And some acupuncturists are also doing recordings of things like acupressure sequences that you can do at home. I've done a little sequence for a lot of my patients where I've made like an acupressure nidra. So I've made it into like a relaxation with points to just boost the immune system during, this time of lockdown. So there's things like that we can do. And also, again, if there is a practitioner who does herbs, they're also able to prescribe herbs. So, if you have got a chronic condition that you're maybe struggling with, if you've got painful periods, endometriosis, fibroids, things that are still having a real impact on your life. And it could be, again, you might suffer with IBS or some kind of digestive disorder, which has a huge impact on fertility. If your body isn't able to excrete properly, you're not going to remove excess hormones from your body. So that will affect hormone balance as well. We can look at all of these kinds of things and use herbs to help you during COVID-19 as well. And it might be actually just someone to talk to, get things off your chest around fertility, and someone who understands and, understands the lingo, knows what treatments are likely to be prescribed.
Perfect. Sounds amazing in such case. And that can help a lot for sure. And staying positive and helping with staying positive, definitely helps a lot as well. And well, let's go to this next question. So how can a TCM practitioner help me in lockdown? You have mentioned this, but
I have, yes.
if there's anything else you could add.
I think just going back to the first question, maybe focusing more on what the individual can do. I think there's a lot of things now that are being, put out on social media that are a little bit more helpful. And I think taking the pressure off yourself, not feeling like you've got to achieve a million things because you're in lockdown. Just relax as much as you can. That awful word that everybody says, just relax. But enjoy this time. Find things that bring you joy, that bring you pleasure. Be it singing. It doesn't matter if you're bad at singing. If you enjoy how you feel when you sing, do it. Bring creative things into your time. Doesn't matter if you're rubbish at painting, how good you are at things. It doesn't matter. It's about, that focus and that kind of, that Zen kind of, what are the words I'm trying to think of? That kind of meditative state that certain things can bring to you can really help just calm you and fill your time. Knitting, that's a great thing. Yoga, there's so many things that are now available to us freely in just huge volume. I mean, it is overwhelming how much we can now access. But now is the perfect opportunity to do the things that you've maybe always wanted to try and haven't been able to. Cooking your perfect meal, those kinds of things will really help. And mindfulness, one of the things I see a lot in practice is that my patients are just working at such a high volume. And I think general life now is so busy. We're trying to keep our houses nice. We've got all these responsibilities at home. Then we're trying to, be the best we can at work. And I definitely think there is a trait in a lot of patients who struggle with fertility who tend to be, that type A, that perfectionist who puts a lot of pressure on themselves. And so one of the things that you could really do to help yourself while you've got the time is think about how you structure your life on a day-to-day basis. How much time do you spend checking Facebook, reading your emails? How much time do you spend working? Where is the time for you? Are you working a 60-hour week and then going to the gym 5 times? Is there really any space for you to relax in there? Are you having that downtime, or are you just running on empty all the time? So if you sit and you literally write down all your responsibilities and all the things you would normally do on a day-to-day basis, then you can look at that and see where can you start putting space in your life for you. Is it that every Friday you're going to have lunch with your friend if you've got the space to do it? Those kinds of things. And also, if you've got the capacity or the financial ability, what kind of things can you delegate? So one of the things that I say to patients who can afford it is, if they're very, very busy and they're stressing about keeping their house tidy, can they make that leap to get a cleaner once a week, once a fortnight, to take some of that pressure off? Can they have a discussion with their partner around what roles they can maybe hand over? Because if you are that kind of type A person, it's very hard to give up. You like to kind of, it's that kind of idea of, I might as well just do it myself. It's hard to delegate. So just opening up the conversation about how you maybe be able to balance your lives together a little bit better when we get out of this. And, just anything you can delegate. Another thing I do when I'm really, really busy, I find it very hard to plan ahead what I'm going to cook. I also work very late in clinic, so I might get home 8:30, and so hopefully my husband will have my dinner on the table. But in reality, he struggles to think of things to cook, and he doesn't have that foresight in terms of cooking tea. So when we're both very busy, what I will do is things like I'll order like recipe boxes. So I use a thing called Mindful Chef that I love, and that will come, and there's all the bits that I need to make the tea, and it only takes half an hour, and that takes a bit of pressure away. And I know then that I'm going to get 3 good meals a week that are nourishing. So if I just have beans on toast one night, or we get, a takeaway another night, it's not such a concern because it doesn't become a bad habit. And I'm also not then going to be picking in the fridge for something as soon as I get home because I'm starving, and then maybe not going to eat as nourishing foods as I would like to. So it's really just looking about what you can get rid of in your life, what you can delegate, how you can make your life easier, how you can start making yourself a little bit more of a priority to try and get that work-life balance back into balance, really.
Fantastic. Thank you so much for providing all the details, but also some examples. Yes, how to do it, how to cope with it. Thanks so much for that. Definitely interesting and very informative. And well, now it's time for your questions. There are actually quite a few questions already. So let's get to them. Yes, are you ready, Laura?
Mm-hmm.
Perfect. So let's go ahead with the very first question we have here. So, how do you know that acupuncture really has an impact by releasing endorphins? Is there a possibility to check the impact of acupuncture on the hormonal balance?
So we know that because there are actually pieces of research that have shown that. So if you want to learn more about it, you can Google for, just looking at the effects of acupuncture. And if you put in acupuncture endorphins research, that'll definitely come up. One of the things you can do, it depends where you are in the country, or which country you're in, and how freely available testing is. Where I am based, testing isn't very freely available. And the NHS hasn't got a lot of money, so testing is also tight on that side of things. But in theory, for example, if you had high cortisol levels, you could have a blood test that has shown that your cortisol is consistently high. You can have some acupuncture, and working with your acupuncturist, in theory, you could then, after some amount of treatment, retest your cortisol levels to show that it had reduced.
Okay, perfect. Thank you so much for answering that question. And your question, for sure, as well. And now we do have a very long question, but don't, well, it's a bit with a history. Okay, so let me get to it right here. I am 39, had a successful implantation last December. However, miscarriage week 5, baby stopped growing and no heartbeat. Since then, I have been doing acupuncture twice per week, in total 8 sessions so far. I will resume the sessions this Thursday and Saturday. My doctor is Chinese, who studied in China and lives in Zurich. Both me and my husband have been doing acupuncture. My diagnostics was YIN deficiency. I was also prescribed herbs. Both me and my husband have been taking them for 2 months. However, I have not got pregnant to this day, but my periods got heavier. My husband's spermiogram was very bad, no normal morphology. He is 59. Did you have cases of female patients who got pregnant naturally despite severe infertility? I am a bit in doubt, but I will continue the sessions up to the next IVF. I don't see how acupuncture can help my husband who has a severe azoospermia.
Okay, so I would say, 2 months is not very long in terms of treatment. One of the things that we definitely see, and I have a really fantastic mentor called Nava Carmen, and she is one of these she's so on it in terms of how her brain works and how she collates data. And for a very long time, I noticed that after about 4 months, I saw a huge increase in my patients conceiving. And she actually collated the data, and she got a bell curve that showed this same pattern. And so it's this same idea we have around the 3 month life cycle of follicles and sperm. So, you haven't quite reached that stage yet where the sperm that have had that full impact of treatment are yet to be fully mature and released. And the same with the follicles. So 4 months is a really good timeline to kind of assess things. One of the other things that I do with my patients is I use things like basal body temperature charting, and that gives us a lot of insight into what's going on in a menstrual cycle. And you can actually see the changes month on month as the body is improving and changing. So you might say, for example, see that somebody has a very long follicular phase and their luteal phase is so short that really they may not have time for implantation to occur. And then you'll see that change over the months as treatment progresses. So it's very good feedback for, knowing that things are helping, because obviously with fertility, there isn't any physical indicators for you to know necessarily that treatment is working. With your partner, it could be if you've got that ability to retest his sperm in a couple of months' time, then you could do that. If you're, on a timeline where you're going to be doing IVF anyway, then if you get to that stage and they collect the sample, you can ask and find out, has there been an improvement in what it was before you started the treatment and what it's like now? We've also got to remember that for sperm, it's not just how it looks under the microscope. There is an impact on sperm on a much deeper level that isn't always tested in clinics as standard. So, there's things like I can't remember words out, DNA fragmentation. And, we now have quite recently the research that has come out and said, yes, DNA fragmentation is an important aspect that we need to consider. So there's a lot more going on under the surface that you can't really see yet. If you're feeling like this, I would have that conversation with your practitioner, and they should be able to discuss with you what they're doing. And, they may be seeing changes, like you said, your periods have changed. So there is something going on there, and you should see little signs of things changing. One of the things I often see as well with male patients, particularly when we're treating the sperm and we're using herbs, is actually they feel a difference in themselves. They have more vitality, more energy. I remember one patient, he said, when I go at the gym now, my muscles are much more defined. He'd seen some physical change in himself when he was training that he wasn't getting before. And it can be things like libido might change. So, have a chat with your practitioner, but also just be patient, because, you're both on the older end of the scale. So things are going to need a little bit more work as well, but have faith, definitely. It's still early days.
Okay, perfect. Thank you so much for your advice on that. And let me go to the next question. This is actually a follow-up from the previous patient, so let me get to it. So I was recommended to continue acupuncture even after pregnancy is confirmed up to week 13. My doctor told me that this is the most risky period when the baby organs start to form. Is that true?
So yes, it is the most risky period in terms of a pregnancy, and it is when the organs start to form. But from an acupuncture point of view, acupuncture is safe throughout pregnancy. There are points which are spoken about as having a potential negative impact on pregnancy, and acupuncturists don't use those points unless they really need to. And actually, what we now know is that points that are generally contraindicated in pregnancy, they don't have such a negative effect as what we used to think. So one of the things we've seen is that people who don't understand the theories of acupuncture have produced research using these points with pregnant women. And when we looked into it, there was actually no negative impact. And if the treatment warrants the use of a point, then it has more benefit than negative. But really, there isn't any concern with using acupuncture throughout pregnancy. There's more benefit, if anything. And if you've got a good relationship with an acupuncturist and you've used them throughout, your journey to conception, then you should have a level of trust and comfort around what they do already. And they're there as your support person. They know what you've been through. They understand a lot of what, has happened. So again, you can use them as a sounding board throughout the early stages. What I tend to do with my patients is I'll do an evaluation with them once they conceive. And based on their history and my kind of instinct around their case, I'll make a decision as to what I want to do through early pregnancy, and I'll put the ball in their court a little bit. So if I feel confident in their pregnancy and I have no real concerns, they have the option to, just kind of peter down their treatment. A lot of patients still want to come back maybe once a month for just a check-in because they felt that benefit of how acupuncture makes you feel, how it increases your energy, and they just want to keep that up on some small level. And so, if you're doing well and your pregnancy is strong, then we might say just come back towards the end of your pregnancy for birth preparation. Or we might say, if you then develop something like morning sickness or pubic symphysis disorder, any conditions within pregnancy that we can also help with, come back then. If you're a case where there is concern or there is a miscarriage history, we can do work to support the pregnancy and help try and carry that pregnancy on through, those early stages. So actually, up to week 13 is one of the more crucial stages that we like to see our patients, so we can, just give them as much support as possible.
All right, perfect. Thank you so much again for your question and your advice again and explaining how it works. Another question is this. So, when is the best time to do acupuncture, before IVF or during, or both? You have mentioned this, but if you could.
Yeah. So before, if we can, if we've got that time and you've had that foresight to be organized, we would definitely prefer for you to come before you start. If we see you and your health is good, there aren't a lot of issues in your history, or it's more on your partner's side, we may not need to see you again until you start, but at least we have that opportunity to check if you do come sooner. Obviously, we want to see you throughout IVF, but ideally both.
Perfect. Thank you so much again for confirming that as well. And now there's another one here. Thank you, Laura. Are you able to recommend UK-wide fertility-specific practitioners who you work in partnership with? And do you have specific advice for women over 45 in terms of pre- and post-transfer support?
So, as I've mentioned before, the fertility support practitioner group, which is set up by a lady called Nava Carmen, that is definitely, my main go-to group if you want somebody who's really got that extra level of experience. So if you look for the fertility support company, you'll find those details there. There are other networks throughout the UK, and if you Google other search engines are available. But if you search for, fertility support acupuncture specialists, those kinds of things will start to come up. But also, you can get in touch. And if you live in a particular area of the UK, it may be that I know somebody within my network that I could refer you to as well. In terms of specific advice for women over 45, it really would be no different to advice that I would give to any other patient in terms of pre and post transfer. A lot of the advice we give is very bespoke. So it's down to, your individual health, your individual situation, and your past history. A very basic advice would just be to eat well, to rest, to keep warm, entertain yourself with light-hearted things. You don't want any kind of horror movies or anything that's going to stress you out during your 2-week wait. But really just look after yourself.
All right. Thank you so much again for that. There's a follow-up question just to make sure you have mentioned this. So 3 months, twice per week is not enough for follicles to improve via acupuncture. One needs 4 months of regular acupuncture.
Okay, so 3 months is the time frame that we like to prepare the body if we're doing treatment before any kind of reproductive assisted techniques. If we're looking at people from a natural fertility point of view, obviously there's so many different variables that can come into play. There can be other underlying conditions. There could be something like endometriosis, things that make treatment a little bit more difficult. If there's a chronic condition, it's going to take a lot more time to make a change within the body. So sometimes we will need longer. But as a guide, ideally, we would like to see you 3 months before you start reproductive techniques. We definitely see a peak in conception around 4 months. A lot of practitioners will kind of review your case on a kind of 3 monthly basis because we don't want you to keep coming month after month after month if things are not working. We want to refer you on, find other avenues, find out why things are not working, and try and get to the bottom of that, so it's not an endless cycle. Some things do take a bit longer, but if you kind of have in your head 4 to 6 months, if you're just looking at using acupuncture or Chinese medicine to try and help you, then that's a fair time scale to see how things are developing. But use techniques like the basal body temperature chart, keeping track of your symptoms and how they change, to give you feedback, and discuss it with practitioner if you're not sure if things are changing. I wouldn't necessarily see a patient twice a week. I mean, in an ideal world, that would be great, but financially and in terms of availability of appointments, that's not always possible. So sometimes, majority of the time, we might see a patient once a week. We might only see patients once a fortnight. We'll try and target treatment around the points in, say, for example, a menstrual cycle where we feel that it really needs attention. So we can try and make it as effective as possible and as cost effective as possible for patients if that is a concern. If money is no object, then, going once a week is usually more than enough. But I would say, yeah, at least 4 months of regular acupuncture is what you want to try and, commit to if you can.
Fantastic. Thank you so much again for your question and your advice on that. Now we will have a longer question right here. Okay, so I'm 40 with low ovarian reserve endometriosis, and I'm 6 months without a period, so I'm hurtling towards the menopause. I'm currently in a guarantee program in Spain with one failed cycle already. Prior to that cycle, went into Chinese herbal medicine store within a shopping center and asked if there was anything to help me. And he looked at me as if I was an alien and shrugged his shoulders. I've never had acupuncture and I'm a bit scared of the thought. My clinic in Spain opened yesterday, but I cannot get my flights yet from the UK anyway. So are there any herbs that can help with an exudation cycle, and more so with the lining? Sorry for the lengthy story. Thank you for that question.
That's okay, Lisa, don't worry. So I would say, really going into a Chinese medicine shop in, a shopping centre is probably not the ideal source of treatment, particularly in a case like yours. You really want to try and find somebody who's got that more specialist training, and also someone who can communicate effectively with you. You want to make sure that they've got a good standard of English so that you know that they're understanding what you're saying and they're understanding your situation clearly. There are definitely herbs that can help increase the uterine lining. And again, there's loads of research out there for herbs on so many conditions. The bank of research that supports herbal medicine is huge. It depends really now where you're at, if your clinic's starting to open, whether you've got time to kind of implement herbs into your treatment plan before you start your medication. And also, potentially you could use herbs throughout an IVF cycle, but your clinic has got to feel comfortable with that and confident. So you've got to have somebody who can talk to your clinic and really communicate with them on that. I think that's it, isn't it?
Yes, perfect. Thank you. Thank you so much for this and for the story as well. We definitely appreciate you sharing this, and I hope that was useful for you as well. Perfect. Thank you so much. I'm looking for the next question. Okay. Perhaps you can tell us, do your female patients got naturally pregnant following acupuncture or rather in combination with IVF?
Yes, they do. I see lots of patients who have had really long histories. I have patients who come to me and they're on the run up to IVF, and through just sequence of events, it may be that they haven't really gone to their GP as quick as they could have because they've hoped that it would happen naturally. So I see patients who've been trying 4, 5, 6 years, and they come and within a couple of months they're pregnant. I have patients who are on their run up to IVF and they fall pregnant naturally. We've had patients who've conceived and they've started their down regulation and then found out they're pregnant. I've seen patients who've been told they can't conceive naturally, who've got blocked tubes conceive naturally. Anything and everything can happen. Nobody's textbook. There's always that potential for those things to happen. And one of the things I see quite a lot is that it becomes a little bit of a chicken and an egg cycle. It's so stressful when you want this so much and you work really hard and you maybe have a really stressful job. One of the biggest things I see is teachers. Huge percentage of teachers visit us because their lives are just so stressful with their work. And again, it's that effect that acupuncture has on endorphins and being able to relax a patient and get you into your sympathetic nervous system. A lot of us are running around in this fight or flight mode all the time because we're just like, got to do this, got to do that, I've got to go here, I've got to get this done. And we don't have that moment to switch off. And also, a lot of people have forgotten how to relax. They'll come and they lie on the couch and they're staring at the ceiling. And I'm like, close your eyes, relax. And I don't know how. We have to train you to do that. And acupuncture is great because it activates the parasympathetic nervous system. And it's that relaxed feeling that you get if you're at the end of a yoga session or you've meditated where you're just really chilled but awakened. And that can sometimes just be enough for somebody to switch out of that fight or flight mode and conceive. So yes, definitely we see patients who conceive naturally all the time.
Amazing. Thank you so much again for that. So, well, this is not actually a question. However, it's a comment, and I think it might encourage some patients that are not really thinking about and might be scared of it. So, acupuncture is totally pleasant. You don't feel much except for a nice wave of heat.
Exactly, that's what I'm talking about. It definitely is. Yes. Some people are scared of it and they really shouldn't be. But if somebody is anxious about acupuncture or scared of needles, just taking that step to have a consultation, feeling comfortable with the person who's treating you is a good start. And what I tend to do, if I get somebody and they say, look, I'm scared of needles, I just take it really slowly and we'll start with one needle. I'll check in, see how they're doing, and I'll say, is that okay? Can we do another one? And, 99% of the time, they're totally fine with it. Acupuncture needles are completely different to what we think of as a needle, in terms of like hypodermic needles for injections. And, those really big hypodermic needles that kind of come to mind when you think of needles, you can actually fit about 10 acupuncture needles down the end of those. The ones I use in clinic are about 1/5 of a millimeter. They're really tiny. I mean, I can show you one on camera if you like.
Sure, go ahead. Sure.
They're really nothing to be scared of. So, I mean, you can just about see them.
Yep.
They're
Okay,
very,
well,
very
I can do that
small.
as well. Perfect. Thank you so much for that. And let's go to the next question. Can you use acupuncture to cure adenomyosis?
So, cure is probably not a word that I would use because adenomyosis is a very, very chronic, serious condition. And it's influenced by the hormones similar to endometriosis. So really, it's not something you're ever going to get rid of. Unless you're going to maybe have surgery, if there's something that a Western doctor can do, depending on the location, and cure with adenomyosis, probably not. It can be controlled though, and in some cases, we have seen it reduce. We've had patients who've been able to have scans, have treatment, and the scans have been repeated at a later date, and we've seen positive changes there. And, we see a lot of patients just for things like adenomyosis and symptom control. And we have very positive results with things like that. The pain and the discomfort go. But cure really isn't a word that we would ever use anyway.
Okay, perfect. Thank you so much for clarifying that. Okay, and there's another one right here. Is acupuncture recommended purely for conception, or is it also recommended for egg collection or for egg freezing only, etc.? Conception not planned right now.
You could use it if you were planning to collect eggs to freeze them, because you're still going to have hormonal treatment, and that may have side effects on you. So again, acupuncture is really good for helping counteract the side effects of medications. Also, just again, that support as you're going through the cycle, relaxing you. Acupuncturists know what's going to happen at each stage. So when you've got doubt and questions, they're there. They can answer those. They can support you. They can relax you, ready for the collection. Again, I've had comments from consultants to my patients, and they've said things like, you've had your acupuncture, because they can see that their blood pressure is lower and they're much more relaxed when they have their egg collection to when they've had it previously and they haven't had acupuncture. So there's so many benefits to having it. So yeah, definitely.
Excellent. Thank you so much again for the details to this as well, and we will be slowly finishing. There are like 2 questions left. However, if you have any left, go ahead and type them in right now. That will be our final call for the questions, and those are quite similar. First one is, do you do electropuncture? And the other one, does electropuncture have the same effect like acupuncture?
So yes, I do electroacupuncture, and it has the same effect. What we do with electroacupuncture is we put these electrodes on the needles to increase the stimulation. So if you've had acupuncture before, depending on the style of acupuncture that your practitioner uses, you may have had them come in and rotate and manipulate needles to increase the response from the body on the needle. What acupuncture does is it does that on a more consistent level. So we attach the electrodes to the needles to give it some kind of continuous stimulation, or for example, we might put it on a setting where it kind of has a rhythmic stimulation to the needle, and what it's doing is just increasing the response, increasing kind of the strength of the treatment that we're giving. So with fertility, we use electroacupuncture quite a lot to stimulate the ovaries. So we use it with polycystic ovary patients. We use it for patients who are poor responders, have low ovarian reserve, and we know it's going to be harder maybe to get the follicles we want out. So we'll use that during the stimulation session as well.
Excellent. Thank you so much for that. And in the meantime, we have like 3 more questions. Okay, so let's get to them. First one, are you based in London? If not, can you recommend an acupuncturist in South London?
I'm not in London, I'm in the northeast. But yes, if you get in touch, we can easily recommend acupuncturists in the south of London. There's plenty of good ones down there.
Perfect. Thank you. And well, just wanted to remind you that if you would like to get in touch with Laura, all you need to do is just simply click on that link and ask your question. It will be directed to her, so she will get back to you, I am sure. And let me get to the next question we have. How long does one treatment last, and how many needles are inserted?
So usually, if you're coming, an initial consultation treatment will vary from practitioner to practitioner, but most practitioners will do about an hour and a half for your first session. The first hour of that is your consultation, and the last half an hour is usually treatment. So an average treatment length is around 20 minutes where you're lying on the couch. That will vary depending on the person's constitution and the treatment that's involved. So for example, if somebody is very deficient, if they had something like chronic fatigue, we may only do treatment for maybe 10 minutes because it can be too strong for their body if they're very, very deficient. So it is tailored, but I would expect the first treatment to be around 90 minutes, and then follow-up sessions would be about an hour, and you should be on the couch for around about 20 minutes.
Okay, perfect. Thank you. Again, there's a like a follow-up, not really a question, but perhaps you can look at this comment and tell us if it's something similar. Hi there. How many needles for fertility? I got 4 or 5 needles in my belly area, one of each wristband, one needle on each leg above the knee, one needle on one each leg inner and front side of leg, and 2 needles on each foot.
Yep, that sounds about right. So again, this will vary depending on the style of the acupuncturist you're seeing and each individual acupuncturist. In traditional Chinese medicine style acupuncture, we tend to put needles across the body. So, you can have needles head to toe. It will range from about 5 to 20 needles in a treatment, which might sound a lot, but really it isn't. But it will vary from, acupuncturist to acupuncturist. But reading that sounds like a treatment that I would give.
All right, perfect. Thank you so much. And you have said that it's like 30 minutes, the session.
Yeah, about 30 minutes you'll be lying on the couch for.
Perfect. Well, there's another question. As you have mentioned, you are in Northeast. Patient is based near Newcastle, so.
Okay, so I'm in Jesmond.
Okay.
She'll know where that is.
Okay, that sounds good. Okay, all right. So, well, there's a comment right here. So, as I've mentioned, that is just a comment, of course, but we will be finishing unless you have any last questions. But there are some thank yous already. So, Laura, thank you so much for joining our Stronger Together initiative. It has been a pleasure to have you here. And to be honest, it has been very interesting to find out about acupuncture, about Chinese herbs. I will definitely say that I've never done it, but it sounds like it's a good thing to try. So thank you so much for joining us and well explaining all the details. As you can see, there are some thank yous right here, and
Thank
there
you for
is
having
also
me.
happy to have you for sure. As you can see, there are some comments I would like you to see. Much appreciated. Thank you for an informative presentation. There's actually
You're welcome, Lisa.
and there's a follow-up from Lisa as well. I thought you might have been Northern when you were talking about having your tea. So thank you for that. For those comments, we are happy that it is helpful for you. And there's one more. It was very interesting session. Feel more confident now. Happy to hear that for sure.
Great, that's great. Thank you.
Perfect. All right, Lisa. Sorry, I'm sorry. I was thinking about the patient, but Laura, is there anything else you would like to add?
I don't think so. I think we've gone over everything.
Yes, definitely. It has been lots of questions for sure. So again, thanks so much for joining us. I hope we will be able to even do it once again. I'm sure there are plenty of things that we could talk about. So lots of topics on that particular field even. So I am sure you haven't said everything. So thank you so much for joining. All of you, thank you for joining us over and over again. And as you know, we will be back here at 8 p.m. UK time. So stay tuned. We have another topic to tackle. And I hope you will be able to join us as well. And well, it has been again a pleasure. Thank you all. This has been recorded. So within the next few days, you will be able to watch it again. So, and also if you have any questions or would like to get some details from Laura, all you need to do is just go to the website. I have sent it in the chat section, and you will be able to get in touch with her. She, I'm sure, will be able to help you as well. And well, Thank you again. Have a lovely evening, Laura. And to all
You
of you,
too.
take care. And
Good night.
well, see you soon as well. Bye.
Bye.